Hi, my name is Dorothe, and I'm here to tell my story so more women can be aware of the options of surgery they can have for breast cancer, and that they don't have to go with, medical establishment that what's available. I had, when I was diagnosed with breast cancer, my first concern actually was, how am I going to look after the surgery? And which is vain, I know, but I think every woman goes through that. And the surgeon I talked to couldn't give me any specific answer. He was very vague. He also couldn't give me any answer how long the recovery would be. It depended on this, it depended on that. And I had, at the time, I had only a window of like maybe 4 weeks to recover, to have the surgery and recover, because I had company coming from Germany for a week in June, for 4 weeks in June. And I also had a lot of, I didn't want my son to know. His wife is expecting a baby in August, so I didn't want them to worry about it. I'll tell them afterwards when I'm okay. And I also babysit my other granddaughter for every week for a whole day from 6 o'clock in the morning till 8 o'clock at night. And you need to be in physical condition to, keep up with a 2-year-old. So all these considerations were in my mind. Plus I have 2 horses, 3 dogs, a bunch of cats, chickens. So who is going to take care of all that? So nobody, the doctors, when I told them, they just said, they looked at me like I'm crazy. Here I should worry about the cancer and not everything else. So I went on the internet and I researched. And I Googled breast cancer surgery. And I came upon the website of Dr. Ancinelli. The more I read, the more excited I got. And I said, this sounds too good to be true. So I made an appointment, and I was not disappointed. Everybody was right away very nice. When I told them my considerations, nobody said, you're crazy. Think about yourself first. He was very understanding, and he answered my questions. He gave me a time frame. He said, no problem, within a week, you can do anything you want. He also gave me an idea how much he's going to take out, how am I going to look, and so I scheduled the surgery. I had surgery on May 12th, and that was a Tuesday. 2 days later, I was babysitting my 2-year-old granddaughter the whole day. I never had 1 minute of real pain, a little bit discomfort, but not more than I had after my biopsy. And it was almost like having a tooth pulled, like going to the dentist's office. That's how I felt. And the surgery itself, you go in, it was very relaxed. It was, I can't describe it but I would do it again in a heartbeat. It's not that I want cancer again, but I think if it would come back for some reason, I would not be so scared, because I know now I can, it's not the end of the world. It doesn't disrupt your life. It's not painful. So after I babysit my granddaughter that weekend, now that was only 4 days after my surgery, I already was riding my horse. Slowly, but I was riding him. And then a week later, I had to go see Dr. Ancinelli again, and unfortunately had the bad news said the margins were not quite clear, so I needed a second surgery, which I was disappointed, but I was not scared because I knew what to expect. And the second surgery went like even better. I was babysitting the next day even. they needed me for Wednesday also. So I went to see her Wednesday, and neither my son nor my daughter-in-law ever noticed any difference. And now it's 4 weeks 3 weeks since I had my surgery, and the second surgery. And my breasts look even. You don't know any difference, and I feel great. And I have the energy, I do everything, I write again almost every day, and it was never a downtime. So I hope that this kind of surgery will be pushed more, and that will be available to all women, so they have a choice. Why go through this surgery where you are laid up 2 weeks or 3 weeks? I have a friend who had the same kind of surgery I had. I was lucky, I only had stage 1 cancer, and I needed a lumpectomy. She had the same thing. She also had to go for a second surgery for margins, and she was very sick. After the second surgery, she got an infection. She was very, very sick. And 3 years later, she had a heart attack. And they said it could have, with the radiation she got afterwards, which I still might have to do. I mean, that does not eliminate any further, treatment. But alone, the peace of mind you have when you go into an office, you don't see this sterile hospital room, you don't see everybody pushing you one way or the other. It's so much easier, it's so relaxing, and I think that's half the battle. Peace of mind, that's what you need. And I just want to get it out and have as many women know about it as possible. And we all have to go up and write our congressmen or the senators or whatever. They have to push this kind of surgery, because that's the only way to go. Okay?